Welcome. Thank you for joining us today, and thank you for all of the questions that many of you submitted ahead of time. I'm Angela Carafazli with New York-Presbyterian's Office of Communications. I'm joined today by Dr. Jason Zucker, an infectious diseases specialist at New York-Presbyterian, Columbia University Irving Medical Center, and assistant professor of medicine at Columbia Vagelos College of Physicians and Surgeons. Today, Dr. Zucker will share his clinical observations about the ongoing monkeypox outbreak, a growing public health crisis here in New York and beyond. He will discuss vaccination and prevention, treatment, the stigma that unfortunately has been associated with this contagious disease, and finally, he'll answer some of the questions that were submitted ahead of time. If you do have any follow-up questions, please feel free to email us at pr@nyp.org, and we'd be happy to get back to you. Dr. Zucker, the Zoom is yours.
Thank you, Angela, and thanks to everyone for joining the Zoom today. To begin, I want to say that we're facing yet another significant public health challenge, and it's critical that we make sure that the public is receiving accurate, actionable information that can help us mitigate the impact of this outbreak. As Angela noted, I'm going to begin by giving you a general overview of what we're seeing clinically as this outbreak continues to grow. I'll discuss how we're treating patients, how vaccines are helping us to address this challenge, and share what I'm telling patients about prevention and safety. I'll also talk about the stigma associated with this disease and why it's important that we move beyond that so we can make sure that people are getting tested, treated, and receiving the care that they need. I'll then answer some of the questions that you submitted. So let me start off with some of the basics about what we know about human monkeypox virus. So first is who it affects. The vast majority of those who've been diagnosed to date with human monkeypox virus are self-identifying men who have sex with men. This is likely due to shared sexual networks. So what we are seeing is they're seeing it first and experiencing the majority of cases. But just like other diseases, there's no reason it can't spread to other communities via sexual or other close contact. We're just starting to see a small number of secondary infections in women and children. It's important to note that all these patients had close contact with someone who tested positive for human monkeypox virus. It's believed that the disease may be more severe in children under 8 and may lead to worse outcomes in pregnant women. And for these reasons, we all have to pay attention and remain diligent. Some of the symptoms of monkeypox virus. So classically, it presents like many other viral illnesses with what's called a viral prodrome. Symptoms like fevers, chills, swollen lymph nodes, fatigue, and muscle aches are common. Within 5 days of the prodrome starting, patients develop a rash that can look like pimples or blisters. The rash can be on any part of the body and is typically itchy or painful. However, during this outbreak of human monkeypox virus, it has been presenting atypically. The prodrome may or may not be present, and while most patients still develop a rash, the rash is frequently starting in the genital and perirectal areas. While swollen lymph nodes remain a prominent symptom, many patients are having swollen lymph nodes in their groin instead of their neck. In terms of spread, it's most common for human monkeypox virus to be transmitted through direct skin-to-skin contact, although it is possible for it to be transmitted in other ways. These include contact with items like clothing and bed linens that were used by an individual with human monkeypox virus, or extremely close face-to-face contact. Epidemiologically, this does not appear to be a significant driver of disease spread. While we're still learning more about human monkeypox virus, it's important to note that it does not spread like COVID through airborne means, and you will likely not get it just from being in the same room as someone. The epidemiologic data we have to date on human monkeypox virus does not support a link to airborne transmission like it did with the coronavirus, where we saw large increases in cases among people who did not have close contact with each other. In terms of infection and transmission, the human monkeypox virus has an incubation period of 5 to 21 days. This means that you can develop symptoms up to 3 weeks after being exposed. This is a long disease. After developing infection, patients are no longer considered infectious after their sores have scabbed over. Those scabs have fallen off and new skin has grown in its place. This process can take up to 4 weeks. In terms of mortality, monkeypox can cause extremely painful, uncomfortable, and unpleasant symptoms, but has a very low hospitalization and mortality rate. So far, there have only been approximately 10 deaths reported during this outbreak of almost 27,000 reported worldwide cases. At our hospital in New York City, which is the epicenter for this outbreak, we're seeing the virus spread in a manner very similar to a sexually transmitted infection or STI. The vast majority of our patients are receiving outpatient supportive care to manage the severity of their symptoms until they get better. However, while we're managing patients in the outpatient setting, we are seeing patients with extremely painful symptoms. This includes painful sores in the mouth and throat that make it difficult to swallow, genital lesions that can become infected and cause significant pain, and many patients are presenting with extreme rectal pain, making it painful just to go to the bathroom. We've had a small number of patients across the New York-Presbyterian system whose symptoms were severe enough to require hospitalization. The ones who have been hospitalized for supportive care or to take care of their symptoms such as pain. Our primary goal is to keep patients out of the hospital and out of the emergency department unless the severity of their symptoms make admission necessary. We encourage patients to see their primary care doctors, urgent care clinics, sexual health clinics, which in the majority of cases will be able to provide testing and treatment. Testing is essential to protect yourself and your partners. I can't emphasize enough that anyone who has symptoms or concerns should see a healthcare provider and get tested right away. Like I said previously, most urgent care facilities and many primary care physicians have the ability to test for monkeypox, and we strongly recommend that those who are concerned get tested there. It's faster and more convenient than going through the emergency room, and they're more likely to be able to provide long-term follow-up care. If you live in New York City and don't have a healthcare provider, you can call 311 to be connected with one. In terms of treatment options, our treatment primarily focuses on treating symptoms and the pain that can be associated with this disease, as well as treating any secondary infections that could arise. For patients with severe disease or at risk of severe disease, we have a limited number of options for the treatment of monkeypox. The most common drug being used currently is Tecovirumet, an investigational drug only available through an expanded access process through the CDC. I want to highlight that while we're using this investigational drug, we do not know if it works. However, formal clinical trials have been announced. In the meantime, our focus continues to be on helping those experiencing symptoms to manage their pain and discomfort and keep any infections in check until symptoms subside. If you don't have a regular healthcare provider, I recommend calling 311 if you live in New York City, and you can be given a list of providers to contact. I want to also make sure I touch on vaccines and prevention. In terms of vaccine, a limited number of vaccines are available through the Department of Health vaccine clinics. All of these come from the strategic national stockpile. At this point in time, the highest risk populations are being prioritized due to the limited number of vaccines available. That vaccine currently distributed is approved for smallpox and monkeypox. It is thought to be highly effective. However, we have limited human efficacy data. It also takes 2 to 3 weeks to work. So it's important that people know that just being vaccinated does not necessarily mean you no longer have to worry about monkeypox, and please remain diligent. For prevention, I encourage my patients who are at higher risk to check themselves regularly for any lesions or early signs of infection. They should also have open conversations with their sexual partners and encourage them to check as well. I also encourage them to avoid sexual activity and other intimate contact while waiting for test results. Testing remains a key to prevention. I can't emphasize enough that we have to eliminate any stigma associated with human monkeypox virus. I would say that one of my biggest surprises has been just how much stigma and shame is associated with this diagnosis. In my clinical practice, I frequently diagnose patients with HIV and sexually transmitted infections, and I've learned to address those concerns, but there's clearly an even heavier stigma around this disease. Even patients with mild disease have been taking it very hard. In addition to this stigma, patients who are diagnosed and are then isolated at home for up to 4 weeks alone. So this disease is challenging not just from a medical, but also from a mental health standpoint. It's important to make sure that we're all cognizant of this, that we all work together to reduce stigma, and that we offer patients mental health and other supportive resources after their diagnosis. Eliminating this stigma and supporting patients is the only way to ensure that patients present for care and receive the care that they really need. I'm not the first to say this, but even the name monkeypox can be stigmatizing, and I encourage media outlets to consider using human monkeypox virus for now in hopes that the name will change in the future. This is a public health crisis, and as a society, we all have a role to play in eliminating stigma as a barrier for testing and treatment. The two most important messages I leave you with today is that if you have lesions, get tested right away. If you're at risk, get vaccinated and check yourself regularly for any evidence of infection. Like other transmissible diseases, we have to have open dialogues and conversations, share accurate information, and give people easy access to care so they can take the necessary steps to get tested, treated, and help protect themselves and others. We'll overcome this public health challenge, but we need everyone's help and diligence to do so. And with that, I'll turn it back over to you, Angela, for questions.
Dr. Zucker, thank you so much for sharing all of those insights. We do have a few more minutes to go over some of the questions that we received ahead of time, so I'll jump in with the first one. What is the biggest misconception about monkeypox that you want the public to know about?
The biggest misconception is that this is always a mild disease. While it's a self-limited disease, meaning it will likely get better on its own, for a percentage of patients, it's not mild and is much more severe than I would have anticipated. There are patients, as I said before, having severe pain in their throats with swollen lymph nodes in their neck, making it painful every time they swallow. Patients with complex genital lesions that become infected and require antibiotics. Patients with urethral lesions causing extreme pain every time they urinate. And finally, and maybe what we're seeing most commonly, patients presenting with severe rectal pain and bleeding every time they go to the bathroom. So for patients with these symptoms, it's an extremely severe disease.
Our next question is, what does this mean to have this declared as a public health emergency by the United States?
So I think the declaration of a public health emergency yesterday is an important acknowledgement of just how rapidly this disease has spread. Importantly, this declaration gives the government the ability to quickly direct money towards developing and evaluating different vaccine and drug strategies, and to utilize emergency funding to hire staff. This allows public health agencies at both the federal and local level to have the resources we need to tackle this disease as it continues to spread.
What do you say to those who think that this is a disease that only affects people who self-identify as gay or bisexual and other men who have sex with men?
It's simply not true, as it can affect any group. While most of the cases we're seeing are in those groups, as I stated earlier, a range of individuals are contracting this disease. As cases increase, it increases the likelihood of occurring in different groups of people. Anybody can contract and transmit human monkeypox virus, so we all have to be informed and remain diligent. Most importantly, we all have to show compassion and concern for those who are fighting this disease.
Absolutely. Is it safe for a friend or family member to provide care for an individual with monkeypox?
Yes, it is safe for friends and family members to provide care for individuals living with human monkeypox virus. The disease is primarily being transmitted from skin-to-skin contact. You likely cannot contract human monkeypox virus simply by being in the same room as someone. If skin-to-skin contact is necessary for caregivers, we encourage them to use proper safety precautions, wear a protective gown and gloves, but we need to take care of our friends and family.
What should you do once you do test positive? Should you be self-isolating, and if so, for how long?
Yes, so so once you test positive, you should isolate. You should speak to your doctor because you need to isolate until all of the lesions scab over and the scabs fall off. This is not an airborne disease, so that also applies to people who are awaiting a test result. They should avoid skin-to-skin contact as well, and isolate until their results return.
And how do monkeypox tests work?
So monkeypox tests work via PCR, very similar to what we did in COVID. A swab is taken, in this case, from one of the lesions on a patient's body and tested for the presence of virus. It may take a couple of days to receive results. So again, symptomatic individuals should isolate themselves while awaiting results.
And when should someone contact their doctor?
Anytime you're concerned. People should contact their doctor if they have new or unexpected rashes or sores. They can advise you on where and when you can get tested. And if you're worried, you should talk to your doctor about being tested.
The next question is, are people who are immunocompromised or people with HIV or AIDS more vulnerable to becoming severely impacted?
So monkeypox is thought to be more dangerous to those who are immunosuppressed, like individuals living with HIV and AIDS. It's also thought to be more dangerous to those with pre-existing dermatological conditions and young children generally.
And why isn't TPOXX being made available to more patients?
So Tecovirumet is an antiviral medication that is considered for treatment in people who are seriously ill or likely to get seriously ill, including those we just mentioned who are highly immune compromised. Right now, the treatment is only available through the expanded access investigational drug process, as it was approved through the animal rule only for smallpox. While Tecovirumet has been shown to have to work in animal models of human monkeypox virus, it has an acceptable safety profile in a limited number of healthy people. We have no clinical trial data and no data about its use in people with human monkeypox virus. Clinical trials are important because they can tell us if a drug works and is safe. This is important because if a drug doesn't work, then we're spending time and money providing medication that does not help, distracting us and diverting resources from finding drugs that do. Randomized trials have been announced in multiple countries around the world, including the United States, and the hope is that this will provide us much needed data on this drug quickly.
How much worse do you expect this to get? Is it too late to prevent monkeypox from becoming endemic?
I don't think we know the answer to that, but I hope that it's not too late to stop human monkeypox virus from becoming endemic. We know that if we want to keep it from getting worse, we need to use all the tools at our disposal. We need to vaccinate at-risk individuals as quickly as we can. We need to ensure that our testing capacity meets our needs. We need to ensure that we have ways to support and help individuals isolating at home and find housing for those living in congregate settings. We need to conduct rapid, scientifically sound clinical trials to ensure that medications we are prescribing work, and if they don't, identify new drug candidates. It is only by using all of these methods that we can reverse the current surge in human monkeypox virus. Angela, thank you so much for your time today and all of these questions. I'll turn it back over to you.
Thank you, Dr. Zucker, for your time, and thank you to everyone on the Zoom for submitting these excellent questions ahead of time. If you do have additional questions, like I mentioned earlier, please feel free to email us at pr@nyp.org, and we'll get back to you shortly. For now, I hope everyone has a great rest of the day and enjoy your weekend.